While accessing healthcare services remains a daily struggle for residents of Lusaka in Mamelodi in Pretoria, the residents there say delays in the construction of a local clinic continue to put pressure on local hospitals and other clinics in the area. The 61 million rand project, which began in 2020 and was meant to be completed in July 2024, has been simply standing as a white elephant with no sign of completion in sight. Zola Sholwana is there and joins us now. Zola, good morning. Another mega project which hasn't yielded the intended outcome. Tell us more.
Well, yes, indeed, Iman. This forms part of projects that have been either abandoned or neglected by government in many parts of the Gauteng province. And we are told that those projects have cost, government over 600 million rands. And this clinic that is in Lusaka in Mamelodi has been standing as a white elephant for the past 5 years. And residents have raised their concerns over the issue, saying that this is a clinic that they had asked for before 2019, and construction began in 2020, and they had estimated that it will be done by end of 2024 latest, and we are in 2025, and by the look of things it doesn't look like it will be complete anytime from now, Iman. There are no toilets. We are still seeing bricks. Unfortunately, we were denied access inside, but from someone that told us who has been inside, this person mentions that there isn't much that is done inside. The structure is up. One would think that there's a lot of work that's being done, and that's what the city of Tshwane said, saying that it's about 93% complete. But when you go inside, you'll actually get to realize that it is nowhere near completion because there is no tiling, and this clinic was supposed to be running by July 2024. We try to speak to residents, Iman, so that they can paint us a picture of how this delay is actually an inconvenience to the entire community that was supposed to use this local clinic that was meant to have 21 casualty rooms and other centers for mother and children. Now they find themselves having to go to the nearest hospital and also flood to other local clinics, and that's obviously putting pressure on them. Some have to wake up as early as 3 a.m. to queue at the nearest clinic so that they are able to receive medical attention. And they've raised their concerns about the delay, saying that a number of officials have been here on the ground promising that they will be part of an intervention to ensure that this clinic is complete. You would understand that last year the former MMC for Health in the city of Tshwane did promise that she will be, conducting oversight visits here and ensure that they speed up the process, and this clinic will be complete by 2024. But that has not happened. Yet again, another MMC in the city of Tshwane, the current MMC of Health, has also promised that she is working with the team to ensure that this project is complete. The executive mayor of Tshwane, Dr. Nasipi Moya, was also here to conduct an oversight visit, also promising that she will ensure that there are funds that will be taken out to ensure that this clinic is able to be used by the community, which it was meant to be used by when it was built in 2020. Back to you in studio.
Zola, now I wanted to come back with a question. I mean, you can see all of these political figures there and making promises. The clinic is nowhere near functional, as you say. It was said to have been 93% ready. But, there's barely any infrastructure on the inside. What have we managed to find out from any of these political leaders about the contracting, whether the entire budget had been paid through to those contractors? Have they reappointed someone else? Has anyone been able to give us tangible answers about the project managers and what their response has been around why this project isn't working?
From a statement that we read from the city of Tshwane, Iman, we were told that there's a number of issues that have contributed to the delay of this clinic, and they had to terminate a contract with the developer that was in charge of this particular facility since 2020, as there were multiple delays. The estimated date of completion was supposed to be end of 2023. They then extended it to last year, July, and the contractor allegedly failed to meet those deadlines. And when you really read about it, there are issues of payments involved in all of this. So there are multiple factors that have led to this clinic being in the state. And there's also allegations as well that there's extortionists that are involved in the delay of this clinic, Iman, and that's partly the reason why most community members are refusing to actually come and speak about this particular clinic, because we really tried earlier on to get residents to tell us and paint us a picture of how they are impacted by this clinic being in the state for over 5 years. And some of them are saying that there's actually a lot that is happening that is leading to this clinic being in this current state. But of course, we will continue reaching out to the city of Tshwane just to really find out what are other reasons that have led to this project not being complete, because we understand that it's not the only one. There's also a court that has been standing as a white elephant here in the city. And those are just 2 projects among many projects in the Gauteng province that are left either neglected or abandoned.
All right, Zola Sholwana, thank you very much.